Hello and welcome to Medical Dialogues. I'm Mr. Zaman and today I'll talk about mouth rinse analysis could spot early heart disease risk. Gum inflammation leads to periodontitis, which is linked with cardiovascular disease. Now, researchers used a simple oral rinse to see if levels of white blood cells, which are an indicator of gum inflammation in the saliva of healthy adults, could be linked to warning signs for cardiovascular disease. They found that high levels correlated with compromised flow-mediated dilation, an early indicator of poor arterial health. The team chose pulse wave velocity, which can measure the stiffness of arteries, and flow-mediated dilation, a measure of how well arteries can dilate, to allow for higher blood flow as key indicators of cardiovascular risk. These measure arterial health directly, that is, stiff and poorly functioning arteries raise patients' risk of cardiovascular disease. The scientists recruited 28 non-smokers between 18 and 30 with no comorbidities or medications that could affect cardiovascular risk and no reported history of periodontal disease. At the lab, participants rinsed their mouths with water before rinsing their mouths with saline, which was collected for analysis. Participants then laid down for 10 minutes for an electrocardiogram and stayed lying down for another 10 minutes so that the scientists could take their blood pressure, flow-mediated dilation, and pulse wave velocity. The scientists found that high WBCs in saliva had a significant relationship to poor flow-mediated dilation, suggesting these people may be at elevated risk of cardiovascular disease. The scientists hypothesized that inflammation from the mouth leaking into the vascular system impacts the ability of arteries to produce the nitric oxide that allows them to respond to changes in blood flow. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.